Hi, I'm Dr. Doug Terry. Welcome back. We're going to talk today about herniated discs. Last week we talked about bulging discs. If you haven't seen that, please go ahead and tune into it. It takes about 2-3 minutes. It'll set the stage for what we're going to talk about today. So remember, we have a normal disc, bone, disc, bone. We want the disc to be really tall and healthy, so it creates a space for that nerve. The bigger the disc, the more of the room the nerve has, right? Now, how do we get herniated discs? Well, first you have to have bulging discs. And if you remember from last week, the way you get bulging discs is by having misaligned vertebrae. So when the vertebrae get misaligned, they're squashing that disc. And as they squash the disc, then the disc can't rehydrate. Remember, throughout the day, through our normal movements of flexion and extension, sitting and standing, the disc is like a sponge in a sink. It fills with water. And as it fills up with water, it maintains its normal integrity. But if the vertebrae are misaligned, the disc can't fill up with water. Eventually what happens is this liquid in the center here gets real bloody, as you can see, as the disc gets damaged. And then the disc starts to get dehydrated, and just like your lip will get dehydrated, eventually through a normal simple movement like bending down to put on your sock, that disc tears, and that liquid, which is very noxious, it burns like acid. And when it hits the nerve, when it breaks out of this disc and hits the nerve, it's searing type pain. So we've treated these very successfully by rehabilitating the position of the spine and opening back up the disc so it looks more like this. Then the disc has the chance to repair itself. So tune in next week. We'll talk a little bit more about things you could be doing about a herniated disc.